Welcome everyone to today's webinar, Engaging Senior Leadership in Your QI Work. This webinar is brought to you in partnership with the National Institute for Children's Health Quality and made possible with funding from the Robert Wood Johnson Foundation. My name is Laura Arena and I'm the Communications Lead for the Public Health Quality Improvement Exchange, which we commonly refer to as PHQIX. Before we dive into the presentation, I'd like to provide a little background on PHQIX and introduce our presenters. So as many of you know, PHQIX is an online community designed to be a communication hub for public health professionals interested in learning and sharing information about quality improvement in public health. Two of our key features include an online database of QI efforts conducted by public health departments across the country and a community forum for users to ask questions and exchange insights. Today's webinar will be archived on the PHQIX website and on the NICHQ website. For this webinar, the sound should be coming through your computer speakers. All phone lines are muted. Please type your questions that arise throughout the presentation into the chat box. We will have time to answer questions at the end of the webinar. Today we're partnering with the National Institute for Children's Health Quality to present practical tips for engaging senior leadership in your QI work. It's my honor to welcome and introduce our main presenter, Meghan Johnson. Ms. Johnson is a public health professional with extensive expertise in directing and managing programs in national nonprofit organizations. She has special interest and experience in working with underserved populations, achieving health equity, and leadership development for healthcare professionals. As Director of Programs at NICHQ, Ms. Johnson is responsible for assuring consistent delivery of NICHQ programs. She has driven engagements in varying size and scope, coordinated communication across stakeholders, managed data collection, reporting and synthesis, and provided technical assistance to healthcare professionals on improvement teams. Prior to joining NICHQ, she served as the National Program Director for the Albert Schweitzer Fellowship, where she monitored performance and directed activities for all U.S.-based programming. Ms. Johnson received her master's degree in maternal and child health from Harvard University School of Public Health and her BA in Human Development from Boston College Lynch School of Education. I'd also like to welcome and introduce PHQIX expert panel member Ty Kane. Ty will close out today's presentation with some key takeaway messages. Ty is an independent health consultant with more than 10 years of experience in public health. He is an experienced coach, trainer, and facilitator specializing in public health performance improvement and is recognized as a Certified Quality Improvement Associate by the American Society for Quality. Most recently, Ty was the Quality Improvement Coordinator and Accreditation Coordinator at Sedgwick County Health Department in Wichita, Kansas, which was accredited in 2014. He earned his master's in public health from Kansas State University. And with that, I'd like to go ahead and turn it over to Meghan Johnson.
Great. Thank you, Laura, and thank you to the PHQIX community and Ty for having me here today. I'm really excited to be with all of you and share 10 strategies for how to gain leadership buy-in and support for your quality improvement work. So before we jump in today, I just want to spend a few minutes familiarizing you with NICHQ. NICHQ is an independent nonprofit organization working for nearly 2 decades to improve children's health. We pride ourselves on being a catalyst for improvement and helping professionals and organizations, I'm sure like many of you, that share our mission to make dramatic system-level improvements. What makes NICHQ unique is our ability to blend how-to skills with specific content expertise in areas where we focus our attention. We target our efforts in 3 main areas: strong start, quality care, and healthy living. Specifically, we focus on giving children a strong start, ensuring health systems address the needs of children and families and offer quality care, and finally, that we improve healthy living practices, policies, and conditions. We work across a wide spectrum of organizations that serve children and families, including traditional healthcare settings, community-based organizations, and public health. So this slide, I don't expect any of you to read the details on this slide. It's incredibly difficult, but we really just wanted to give you a mental picture of NICHQ's long history of improving children's health in our 3 focus areas. If you'd like to take a deeper dive and actually, find out what these projects are, this timeline is available on our NICHQ website, and you can actually read about many of the projects that NICHQ has conducted and our different areas of focus over the years. So through the years and all of NICHQ's efforts, we're seeing results. So this is just a quick snapshot of some of the results and impact that we've been able to achieve through our more than 60 projects over the years. So let's dive into the purpose of our call today. Here's the challenge. Most people don't naturally embrace change, and that includes leaders. 70% of change programs fail, and change efforts in the healthcare and the health industry are no more likely to succeed. But what we do know, and I think this is why so many of you are on the call with us today, is that leadership is one of the key predictors and a correlate of our success. Within health improvement efforts, there are typically three types of leaders, and many of you today may represent one of these. The first is the executive or administrative leader, and this is the senior leader who sponsors the change effort. This might be an executive director of a community-based organization, a chief medical officer, a director of nursing. It could even be someone in the C-suite if you're in a hospital institution. The second type of leader is the improvement project or initiative leader. This person can be at any level within the organization or institution, but is really the person charged with leading the change effort. And finally, but certainly not last, but finally there is the frontline leader, and these are the people who have contact with those being served, and they're actually leading and testing changes on the ground. So our first strategy, and this first strategy we actually divided into a 1A and a 1B, because there's kind of two parts of this. But once you've determined the type of leader that you're trying to engage, so think about your leader's personality. Once you've determined what type of leader you're trying to engage, remember that they're going to respond to different motivators. In order to communicate effectively with the leaders you're trying to engage, it's important to gain an understanding of their leadership style. What is their personality type? How do they respond to information? This will help you pick the right tools in order to communicate effectively with them. Who are you trying to sell this idea to? It's going to be critical to your success. You might want to ask around to your colleagues and others, what convinces the leader, this person? Is it numbers or is it stories? What do they respond most to? Does this person tend to be an early adopter of new ideas, or does it take them a little while to warm up? Are they more of a laggard? But use this information to better shape your approach and your communications with them. The second thing when thinking about your leader's style is to understand their appetite for change. So I'm sure this graphic is familiar to many of you. This is Rogers' diffusion of innovation curve, and it explains the spread of new ideas across a society or across an organization or department. You'll see that it divides the population into 5 groups, and many of you who lead change efforts are actually innovators or early adopters, which you'll see on the left-hand side of your screen. It's important to understand the features of each group to effectively engage leaders in improvement. And it's also important to remember that a person can be in one category for one initiative and another different category for something else. So the innovators, which are just 2.5%, they're folks that have a great interest in new ideas and a desire to be daring and risky. They can cope with uncertainty regarding change, but they might not be respected necessarily by other members of their organization because of the risk that they take. The best way to engage folks that are innovators is to pitch your improvement initiative as an opportunity to explore new horizons and connect with other innovators. Then the early adopters. These are the critical group for change, and these are the opinion leaders. They're often role models for others that respect them for their judicious innovation decisions. They're not too far ahead of the rest of the organization as compared to those innovators, which are just the 2.5%. they're actually usually the easiest leaders to engage in your improvement efforts. If you can position your initiative as aligned with other organizational activities, but still at the leading or cutting edge, you're going to be most likely to engage this group, the early adopters. And then you'll see the chasm between those first two groups and the other three. So it's really important that when you're thinking about communicating with your leader, that you know which side of the chasm both you and your leader are on, to determine how much organizational momentum you'll need to build before truly engaging them. The vast majority of folks fall into the early majority and the late majority categories. So the early majority adopt new ideas before the average member of the organization. They may often make decisions slowly and carefully and follow with deliberate willingness in adopting change, but they rarely lead. This group will likely need to see early evidence to get on board. If your leader is in the early majority, consider explicitly aligning your change effort with national priorities and using improvement data, both of which we're going to discuss in a little while, and showing that you have your early adopters on board. The late majority, which you'll see next, that's a lighter green shading, part of the curve, adopts innovations after the majority of the organization and are generally more skeptical and cautious. They may respond to pressure from their peers and to new organizational norms. And if your leader falls into the late majority category, it's helpful to show what similar organizations, and oftentimes those that you're competing with, might be doing. So, for example, your executive director may respond to information like being the only agency in your community not working on a specific cause, like obesity, especially if your mayor or your public health department has made addressing obesity the new norm. Your providers might respond to data from other providers within the same institution that convinces them that giving the HPV vaccine or perhaps providing after-visit summaries is the new standard of care or a best practice. And finally, the laggards are those that are rather isolated and interact with others with traditional values. They're usually the ones that make decisions based on what's been done in the past, and they often do not contain any opinion leaders and are often suspicious of change and change agents. The good news for all of us today is that most leaders don't fall into the laggard category, but if this is your leadership, the leadership side, where your leadership lies, tie your initiative to what's been done in the past and what has been successful. Our second strategy for engaging leaders in your QI work is to establish a clear and ambitious vision that can inspire and engage a variety of leaders. Talk about both the short and long-term implications of the improvement initiative, as well as what would happen if the change efforts fail. Begin with the end in mind. Plan for sustainability and spread from the beginning. You'll want to vet your aim with a broad group of stakeholders, including those that will be affected by the changes, like your frontline staff, your patients, your families. And once you've agreed on your vision, make sure you tell people about it. So share it with the leaders at all levels, with your team, your strategic partners, and with your community. Our third strategy is to align your aim with strategic priorities. You want to be sure that your vision or your aim aligns with your organizational mission and strategy. Show your leader how it relates to organizational goals, such as high-quality customer experience, employee recruitment or retention, or the bottom line and cost savings. Administrators and senior leaders are charged specifically with providing high-quality customer experience. And when I refer to customer, this can be a patient, this can be a client, this can be a community member. Positive word of mouth and publicity from customers or clients or patients means more consumers, which will ultimately lead to more business or potentially more grant funding or contracts. It's important for administrative leaders and senior leaders to keep their employees happy. So we know that organizations compete for great talent. And by showing that your change effort or your initiative increases joy or satisfaction in work, will increase the likelihood of engaging leaders in your effort. And as we all know, the bottom line is important to leaders at all levels, and this is especially important in our public health work today. If you can show that your initiative increases efficiency, you can link it to projected cost savings as your improvement efforts spread. This is a quote from Rockford Memorial Hospital, one of 89 hospitals that participated in Best Fed Beginnings, a national effort to increase the number of hospitals designated baby-friendly, which was led by NICHQ and the Centers for Disease Control. It shows how participating in the initiative gave the hospital a competitive advantage for women choosing where to deliver their babies. Our fourth strategy, use evidence to make your case. Leaders want to know that you've done your homework before committing resources to a new project. Share the evidence behind this change. Is this a best practice? Who else is doing this and has it been successful? Think back to our first strategy about understanding your leader's style and personality to guide the type of evidence that you share. Is it enough to demonstrate that this is a best practice and aligns with strategic priorities? Or do you also need to demonstrate that others in the field, possibly your competitors, are adopting these changes? Our fifth strategy is to use other voices to build engagement. So think about how you can engage a multidisciplinary team to build momentum and support your change effort. Leaders at all levels should be part of this work. Senior administrative leaders, organizational leaders, frontline staff, your patients, and your families. Including these diverse voices of support will build leverage for getting leadership buy-in. Along the same lines, when we're thinking about using other voices and sharing, we want to include our patient stories and our patient and family voices. So at NICHQ, we prioritize the patient or family perspective and voice in all of our work. And actually, just this spring, NICHQ hosted a first-of-its-kind expert meeting that included an equal number both of parent and family experts alongside leaders of community organizations, physicians, and industry. And we really can't imagine that meeting without having all of those voices and all of those stories present. So when you're thinking about how to engage your leaders, use the patient stories to explain the importance of your project and the need for action now. And so this quote from a patient participating in one of our sickle cell disease projects says, "It's a horrible feeling when the one person that is supposed to make you feel better doesn't believe you are in pain," says Fatima Ayoku, who has had sickle cell disease all her life. "They ask the most annoying questions in order to figure out if I'm merely there for the painkillers." So if we didn't talk and listen to what our patients had to say, we might not actually know what the real story is going on. We just are operating from our one perspective. Think about opportunities to include your patients, your families, and others that you'll be serving in your change efforts. Our seventh strategy is to think about who you're disrupting and address their concerns head-on. Don't forget to include the stakeholders that aren't sure about this change effort or are naysayers. And I'm sure many of you have encountered many these folks along the way, and I guess that's probably why many of you are with us today. Who are your change efforts going to disrupt? So let's think about the people that are outside of your department or your specific project. How is the change going to disrupt their work? And what's going to stay the same? So you want to get to these folks before they have a chance to catch up with your leadership. Understanding how to communicate that with them is going to decrease your deterrence. You want to bring them in early, and you're actually going to you might find out that some of those folks that were your strongest resistors are your biggest champions. So in NICHQ's experience with hospitals across New York State to improve maternity care practices, several of our teams actually encountered labor and delivery staff that were very resistant to the proposed practice changes, despite being rooted in evidence-based care. It was a change in practice for some, something that was going to change their work and how they practice medicine or how they practice care after many years of doing the same thing. And through some support, our team leaders were able to bring these individuals into the conversations early. They listened to the concerns. They asked them to try it, or as we might say in quality improvement speak, to test the change. We weren't implementing this. We weren't adopting it across the board, but let's just try it. Let's try it this one time with this one patient. And for many of these frontline staff, what they learned through the process, it actually opened their eyes, and they ended up becoming some of the biggest advocates for the work. And we see this time and time again. So just because someone is resistant doesn't mean that you should ignore them or leave them out of the loop. Bring them into the fold early and engage them and bring them in early and often. Our 8th strategy is to use data to build will. So we collect data to tell us whether the changes we are making are actually resulting in an improvement. Measuring is critical to support the improvement work of the team. It's a unifying voice, it's the voice of our system, and it actually tells a story. So you'll see here on these graphs, you can't look at them too closely, but from, just generally you can see that things are improving. You have, the line is increasing. So we're not just saying, we're not going on the stories, we're not going on that nurse who says, yeah, I think that was great, it worked really well, or on just the one individual who said, oh, that was an awful experience, this isn't making any difference. We're actually collecting data, and we're looking at it on a monthly basis, in this case monthly, but on a regular basis, to really look at what's happening and how are things transforming or not in our system. So you want to collect your data, and then you want to share it. So share the data with your team, with those that are testing and trying these changes and working on this initiative. Share it with your colleagues. Share it with your leaders. Post it in the coffee room, the break room. Use the data to start a conversation about what's going well and where there's more work to be done. And even after your change effort, you think you kind of completed the focus of your change effort, keep collecting the data, because it's going to show you if things are starting to slip or if something's changed. This can be kind of your barometer for your change efforts. Our 9th strategy is to communicate to create a groundswell. So develop a communication strategy for your efforts that includes the vision of your work, how it aligns with the institutional mission and strategic priorities, and describes for folks, well, why this and why now? This gets back a little bit to our creating a sense of urgency. Why are we doing this? Why is this important? You want to use your existing communication systems and your standing meetings to share the work. So as I just mentioned, is there a bulletin board in the break room or in the kitchen where you can share the aim and the vision for this work and some of the data that you've collected? Where can you post updates? Are there standing meetings that you have? Are they staff meetings? Is it a patient and family advisory committee? Is it a board meeting or some other venue where you can share the work and the updates on what you're doing? Our 10th strategy, and in some ways for me this is one of the most important for your ongoing improvement efforts, is to really create opportunities to celebrate. When you have a quick win, when you've tested something, you've tested a change in your improvement efforts, and it was incredibly successful and people are really excited about it, celebrate. Celebrate the folks that tried it. That nurse who wasn't sure she was going to like this and she just tried it, let's celebrate that she tested it and she gave it a try and went outside her comfort zone. Give honest appreciation to those that are participating in this work. When you're celebrating, you're also, that's part of your communication strategy, and you're giving it visibility for your project, and you're raising the momentum and the sense of urgency around this project. And make sure that you share the credit for this work with your leaders and with others on your team. So, NICHQ really places a huge emphasis on this for the folks out in the field that we work with, and we're really encouraging them to think about how they can celebrate their teams and celebrate all of their accomplishments. And just recently we held what we called a celebration webinar. So we had reached kind of a highlight or an endpoint in our improvement work with a group of hospitals, and we had a celebration webinar to recognize them for all of their work and to let them share the accomplishments of their team and with their patients and families. And it was really a highlight for us because we had one of the teams, this was a virtual webinar like we are today, but we had one of our teams that had gotten together, and they were probably about 12 to 15 folks in a conference room. They had brought lunch, and you could hear them amongst each other celebrating and just laughing and really just thinking back to where they were 18 months before and where they are today. And so it was really wonderful just to hear their excitement and see how they were coaching and spreading this to each other. And so as much as you can think about these, celebrating your wins and these opportunities, this is going to be really critical for continuing the engagement of your leaders. So showing your leadership that their accomplishments are being made, that the work is moving forward, and that you're celebrating your team and all that your team has done. This is going to continue to bring your leadership on board and to continue to get their support behind your effort. So, and as I mentioned at the beginning of the call, NICHQ provides a variety of services and offerings to support our partners in our improvement work. So if some of you on the call today need help with tracking improvement data, we have a web portal called the Collaboratory that teams can use to customize data tracking and sharing data and facilitating collaboration and improvement. It's a tool that we can use to share our data with your leaders or with others. If you're looking for a partner to potentially execute a major quality improvement initiative or a strategic planning effort, we can offer assessment and strategic planning consulting, project management or execution support, and certainly expertise in measurement development. We'd be happy to customize online or in-person trainings for your group or organization to build quality improvement capacity. So all of these things that NICHQ may or may do can be explored on our website, nichq.org. So thank you for having us today, and pass the ball back to Laura.
Thank you so much. Thank you so much, Megan. That was great. Before we turn it over to Ty, I just want to remind everyone that if you have any questions that have come up after listening to Megan's presentation, please feel free to type those in the chat box, and we'll address them in Q&A shortly. So now I'd like to go ahead and turn it over to Ty Kane.
Yeah, thanks a lot, Laura, and thanks, Megan, for your insight, words of wisdom. That was great. Just as you talked, you helped me, convey a message that I'm going to share in just a little bit about the value of telling good stories. I thought it was really cool how you basically broke down 12 to 15 years of work at NICHQ into a table of, I think, 9 or 12 impact statements. I thought that was really neat. Well done. So I'm going to spend around 5 to 10 minutes, hopefully 5 minutes today, talking with you about 3 takeaways from that session, and also just three general recommendations for those PHQIX users who might not be agency leadership, but are responsible for some of the day-to-day work in the agency. I'm also going to point out a couple of resources on PHQIX website related to daily QI leadership. So I want to talk about 3 takeaways. This idea of multiplying yourself, telling good stories, and keeping it simple. So let's talk first about multiplying yourself. The success of an agency-wide QI program or QI activities should not, and they can't be dependent on just one person. a public health QI leader should train up others to do some of the work. When I say the work, I'm talking about the training, continuing to encourage folks to use QI tools, developing QI plans, and implementing QI plans. So again, the leaders in the agency should train up others to do some of that work. When you multiply yourself, I think you'll find that you'll also multiply the success of the QI efforts in your agency and grow your QI culture. So what might this look like? How can you multiply yourself? A couple of ideas. Number one, I mentioned you can invest in others. A few ways to do that. One, you can invite people to participate in QI activities. That could be just daily use of a tool. It could be, hey, come to this brainstorming session. I think you'd benefit from it, or we could benefit by having you there. You might ask them to sit in on a QI project meeting for insight, or just to sit in and see what it's all about. Another idea might be to encourage them to sit in on an agency QI meeting just to get a feel for what's happening agency-wide related to QI. Another way to invest in others is just to constantly encourage them to use QI tools in their daily work. That could be things like quality planning, Gantt charts, could be brainstorming or root cause analysis. And then finally, follow up. Make sure that you follow up and ask them how things are going. So another way to drive this home and multiply yourself is by modeling. So model use of QI tools in your own world. When QI leaders model QI tools daily, that behavior can snowball. And as you implement QI tools, make sure that others see the positive impact of that tool in your daily work. So last, another way to multiply yourself, make sure that you're making training resources available to others. One way to do that is to provide training, make sure that training opportunities are available. So consider the competencies for QI leaders in your agency. So what's the relevant training for a QI or a performance improvement leader, and make those resources available. Another is to eliminate barriers between staff and QI resources. So create a path of least resistance to things like flip charts and markers and Post-its, memory joggers and the QI encyclopedia in the meeting rooms. Also make sure that staff, your colleagues have access to online resources. Also, it doesn't hurt to communicate. So send out email blasts or regular newsletters that point staff to QI resources that are available. So number two, another takeaway is this idea of telling good stories. And again, I think folks at NICHQ did an excellent job of even doing that in their slides just a little bit ago. I recently read an article talking about stories. It said business leaders won't be heard unless telling stories, facts and figures, and all the rational things that we think are important in the business world actually don't stick in our minds that much at all. But stories create sticky memories by attaching emotions to things that happen. So the author went on to say that this means leaders who can create and share good stories have a powerful advantage over others. So think about, how can you tell stories as it relates to your work in QI? If you're not a good storyteller, that's fine. Just like any competency, practice can make perfect. Everybody has the ability to be a better storyteller, so learn how to tell good stories. I'm not sure that storytelling is going to show up on the Foundational Public Health Services list of capabilities, but I think we do know that it's an important competency for QI leaders. Last thing on telling good stories, just remember to consider, sharing stories with internal and external partners. Just this week I heard from a friend who's a director at a small, mid-sized local health department, and they've, in the recent past, struggled to communicate the role of public health to both internal and external stakeholders. And she told me that their agency executive recently reached out and said that he actually loves storyboards. And I think what's at the heart of that request for storyboards is a search for an impact statement, or a concise description in lay terms of the difference that your efforts are making. So he mentioned that he wants to learn for himself about the impact of the agency, and also so that he can tell stories to the community about the work they do. A couple of resources related to storytelling. One is I did a quick search this past week and the week before of some of our public health training centers across the country, and there are some trainings out there, free trainings, that can point you in the right direction, help you become a better storyteller. So I'd encourage you to reach out to that network. NNPHI, the National Network of Public Health Institutes, is a PHQIX partner, and you can find information about them on the PHQIX website. Another, I think, helpful resource is just this idea of an impact statement. Do you think about impact statements? Each of the PHQIX submissions that you'll find on the PHQIX website includes an impact statement. So this is, the story that can be used to communicate with the public, elected officials, supporters, and stakeholders, or the community at large about the value of the work, in this case, the value of these QI projects. So next takeaway, I want to talk about keeping it simple. So one role of a QI leader is to remove obstacles that prevent others from finding success in QI. You need to be really clear with staff about what's expected of them related to your QI program. So that would include, weekly or annual expectations. What are the deliverables? What are you asking them to do? And then when are things due? Also, in the spirit of keeping it simple, folks should know where to find resources electronically, on a bookshelf, wherever it might be, to help them carry out the tasks that they're required to do. Might be self-improvement training, might be executing a QI tool, might be a QI project. Need to let staff know where they can find those resources. Also, need to let folks know who they can talk to, who's the person that they can call or email if they need help. So one important resource, I think, for keeping it simple are some of the example quality improvement plans that you can find on the PHQIX website. One of the most popular posts a couple of years ago on the site in the community forum was about, asking for a place. Where can we share and receive QI plans? And so in response to that request, PHQIX has made this resource available where local health departments, state health departments can share their agency QI plans. So you can go through the plan itself and see, did this agency do a good job of communicating clearly expectations, and where are the resources? So look to that resource for some exemplars. So finally, I'll wrap up with this slide, and basically to drive home the point, the PHQIX really does support QI leadership efforts. A couple of examples. Right now there's a QI Spotlight article called The Role and Necessity of Quality Leaders in Public Health. I'd encourage you to take a look at that. There's also a number of ongoing conversations in the community forum related to leadership. A couple of them have very low responses. A couple have high responses. One is called Getting Leadership Buy-In. I'd encourage folks to jump on the forum and reply to that one. There's also an ongoing conversation about this idea of what are the competencies for quality leaders in public health. So something else to look for. And finally, under the About tab, under QI Resources on PHQIX website, you'll see some links to various QI resources. That includes national organization websites, general quality improvement online resources, access to state and local or tribal QI pages. Some of those are just unbelievably helpful. I visited pretty frequently the state of Minnesota, the state of Washington's sites, extremely helpful in terms of practical tools and examples. And finally, there's also, under the About tab, under QI Resources, a number of articles that speak specifically about QI leaders and leadership in public health. That's all. Laura, I'm going to turn things back over to you.
All right. Thank you so much, Ty. So we have received some questions from the community, and I will start with this one. I think this is something a lot of folks can really relate to. what if the project isn't moving forward? How can you still keep folks engaged? And I'll invite Meghan and Ty to respond.
Great. Thanks, Laura. So it's hard to not know a little bit more about this, but I think I'd love to know more. But I think certainly, from my perspective, if things aren't moving forward, I'd ask whether you've had the chance that you've gone back to the evidence and you've made the case again. Again, creating that sense of urgency. Reminding whether it be your senior leader or even the folks on the team, if that's where kind of you're having an issue, you're just having trouble mobilizing your group. Make the case again. Why is this so important? Why did we undertake this initiative? And why is it important now? Where is that sense of urgency? And I guess I'd also ask or suggest that you think about trying something new. So here at NICHQ, we focus a lot on testing small ideas, and I use the word test, but trying things, starting really small and trying one test of change. And so, if you've been trying the same things and it's not working, maybe go back to kind of your change ideas or your drivers of improvement and try something new. Change things a little bit. So we're not having much more context about kind of why it's not moving forward or what's going on. Those would be some of my tips. Hi.
Yeah, that's good feedback. That's always a challenge on these webinar calls is, wish we could ask that follow-up. But no, I like what you're saying. I think in an organization where you've got strong QI leadership, you can probably point back to, the root cause of, why was that project initiated in the first place? Maybe take a step back and say, is there value? I see, challenge the situation. I see that folks aren't showing up. I see that the process has hit a bottleneck that it can't push through. Ask some good questions to assess whether or not that project needs to continue. Maybe the group needs to fold it up and create a new problem statement and essentially start over.
Great ideas. Thanks to you both. We also received a question about whether NICHQ would be willing to share the link for the CoLab info. And just as a reminder, this is the state-of-the-art web portal to track shared data and collaborate that NICHQ has. And we will disseminate some additional information about what that's all about when we send links to the archived recording and the slides. There are very specific communities for each CoLab, so stay tuned for more information on that for anyone who is interested in more information. So our next question is, please share strategies or stories of how a hardworking hospital QI team can keep higher level management actively engaged in supporting their efforts with staff.
Hi, do you want to take this one first?
Meghan, I think that one's teed up for you.
Okay, perfect. All right. Well, so thanks. So, my recommendation would be, tying this back to the mission of your hospital and your institution, bringing it back to the radar screen about, how this aligns with your organizational priorities, your mission. How can you tie that in with what the senior leaders are really focused on and what they care about? And then I guess the other thing I'm thinking is, how do you want them to be engaged? What is it? Is there kind of a need? What are you asking of them? Is there something that you need them to address or to do? And making sure that your messaging to them and how you're communicating the information is clear and concise and really has that ask up front. So you want to make sure you can catch them perhaps in the hallway, in an elevator ride, and just, quick sharing an update on what's going on, what's kind of your elevator pitch for your work and some of your, some of those wins and those accomplishments that your team has accomplished. How can you kind of pique their interest, have your elevator speech at the ready for when you do see them, so that maybe you can then get on the books to come back and share the story in a larger way. But I would encourage you that, when if and when you get that longer time with that leader, you want to have that ask ready. So, are you there just to update them and inform them on all you've accomplished, or is there something you need from them? Do you need them to help kind of free up resources? Might not be financial resources, maybe it's human capital. Maybe you need more of someone's time to work on this effort or to be focused on it. But think about what's the ask? What are you asking from them, and make sure that it's very clear in how you're asking that of them. What are you asking them to do?
Thank you, Megan. Our next question is for Ty. In response to one of your takeaways, could you give an example of a daily use of a QI tool?
Yeah, that's a great question. So when I think about some of the quality-related activities that might happen in a, for example, a local health department setting, you might see, a QI project is happening, and so there's time and resources. You might have a chartered team that's addressing that issue. That project may have been identified through feedback from a performance management system, or it could be a low-hanging fruit kind of a project that a team has identified. So those are projects, and so I think the motivation to keep those going is to complete the project. There's also this idea of just using quality improvement tools on a daily basis outside of the scope of an improvement initiative so that you can, have better outcomes and build QI culture by using a more deliberate and defined model or tools to break through some challenges. And so that might include, studying, helping make a decision, for example. There are a lot of quality improvement tools that might help you make a decision, brainstorming, using affinity diagrams, things of that nature. Planning tools, I mentioned in my comments, the idea of just using Gantt charts and encouraging people who aren't otherwise all that organized, maybe just use a Gantt chart to organize their work. So, those are a couple of examples of how I might see folks using QI tools or having daily use of QI tools.
Great. Thank you, Ty. Our next question is, it is generally said that approximately 20% of the time should be allocated for improvement work. For your improvement projects, have you been able to do this? Let's start with Megan.
So I think it's probably different within any project or at any place. I actually didn't know about that. I didn't know about that recommendation. So Taya, I'd be interested in your comment on that. But I think it varies for us. It varies across our work and across the type of institution where we're working and the type of folks that you're engaging on what their bandwidth is and their capacity to take on improvement work. I mean, for NICHQ, many of the people that we work with, they're not dedicated to improvement, and so they're taking this on above and beyond their existing responsibilities, and so how they're fitting that in is often going to be reliant on the senior leaders really opening up their capacity to be able to do that. And I guess it also relates to whether this is just an independent initiative or, how the team is working together. So, again, bringing this back to the idea of many voices, bringing together a multi or cross-disciplinary team and working together to kind of move the work forward.
Yeah, that's good, Megan. I'm guilty of using the 80-20 rule at home with my kids and in various other settings. So it sounds like maybe it could have been somebody trying to use the 80-20 rule. I do recall from some of the non-public health, non-social services, quality improvement work about Duran mentioning, 20%. I think it's 20% of your time ought to be focused on defects. So it could be that you're referring to that. If that's the case, I think in public, based on my experience working with agencies in governmental public health, it just really depends on the agency. It depends on the level existing QI culture. That would include, the infrastructure to support a QI initiative. It depends on the model that they're using, and also depends on who is executing the project. If it's somebody in a setting like a clinical setting where they've got a reporting structure in place with the quality assurance and they need to have a quick turnaround on an improvement, that's going to be different compared to a practitioner trying to apply quality improvement in the community engagement setting or the health promotion setting. So I think it's going to vary, but I think that's an excellent question, definitely something to explore.
Great. Thanks to you both. Our next question is, what if you have buy-in but senior leadership is expecting too much too fast and blaming staff? And for example, this audience member mentioned a 3 to 5 year QI project where leadership is unhappy that they aren't seeing results in 8 months. Meghan, would you like to tackle that first?
Sure. This is a really, really tough one, and I think one that we actually often experience in our work here at NICHQ, because many of the issues that we're tackling are long-term issues. We currently have a collaborative innovation work with infant mortality, and we're not going to move the needle on infant mortality in 8 months, certainly. And so this is a constant, a battle or a struggle that we experience in many of our projects with these outcomes that we're looking to shift. So, I would certainly bring your leader back to kind of the evidence and, what do we know about this issue? And so what do we know about the issue? Remind them about why did we select this as a 3 to 5 year project? I mean, if we thought it could be accomplished in 8 months, it should have been an 8-month project. So thinking for that leader about how are you going to frame your results? So, what have you accomplished in the 8 months? What's your bringing them back again to what's the longer term aim? If this is going to take 3 to 5 years to accomplish, what's the goal or the aim at the end of that? And then what are our intermediate points, and how do we celebrate, recognize those wins along the way? I mean, for much of our work, you have an outcome, you have an aim that you're trying to reach, maybe in that 5-year mark, but then you're going to have those kind of process measures that you'll be looking at along the way that are going to be the markers or the indicators that you're on your way towards that long-term goal. So I would think about kind of what are the intermediaries and what are those other, process measures that you might be able to look at and share with your senior leader to show that you haven't accomplished it yet, but, you're turning the tide, you're on your way to accomplishing that aim.
I think that's a great answer. I was just, what you said at the end, Meghan, resonated with me, and that's just the idea of what is this 3 to 5 year project? If it's something like we want to reduce infant mortality in these target zip codes, I mean, that would be, maybe an example of something that you might work to accomplish over 3 to 5 years, and exactly what Meghan said. What are the benchmarks along the way? Not the benchmarks. What are the measures along the way? How can you gauge progress in the project along the way? So yeah, excellent feedback. I just wanted to say too, if you're in an initiative like this, or this is your situation, I think it's really important too to just kind of assess, along the way, remind people, where have we been? Where are we now? Where is it that we want to go? Continue to paint that picture, frame it that way, so that people can think seriously about the timeline and what the accomplishments are.
Great. Thank you, Ty. Our next question is from an audience member who noted that your strategies remind me of what can be captured in a Lean A3 report. Do either of you have familiarity, or have you used these types of reports or another type of tool to plan or disseminate or communicate the QI project story?
Meghan, I'd make a quick comment, and that's just that I think that's an excellent idea. That A3 tool, which I think is awesome because it's named after the size of paper. There aren't many tools that can claim that I'm aware of. But it really does capture the story along the way. And so in some ways it is a storyboard. I'm not sure exactly how storyboards became so popular in public health, but it is something that's common across, I think, the country and local and state public health. Yeah, but no, that's an excellent idea. Good question.
I mean, yeah, I would just say again, especially if you're thinking about your leader and sharing this with your leader, you know, whether if it's the lean A3 report, great, or if it's something else, you know, if depending on kind of the personality and the style of your leader and what's going to appeal to them, you know, thinking about modifying it to frame, you know, your work in such a way that's really going to appeal to that leader's style.
Thanks to you both. Our next question is, does program evaluation fit in here? Does QI include evaluation, or is evaluation QI?
Yeah, I'll just jump in. So the question is, how does program evaluation fit in here? I assume you're talking about leadership in the agency, and you say it seems like QI includes evaluation, or evaluation is QI. I think they're different, and so I think in an agency it goes back to how is it defined? How are those two terms defined in the agency, and what are the processes or systems in the agency that support quality improvement and that support evaluation?
I think we also really, you know, at NICHQ we really emphasize that quality improvement work and particularly the data is for improvement and for learning and not for judgment. So, you know, I think just keeping in mind that it's important, you know, we want to evaluate the effectiveness of our programming, of our activities, absolutely. But for quality improvement, we're looking to learn from that information so that we can make a difference and we're not, you know, making a judgment based on what we learn.
Thank you. Our next question is, how does one meet and balance public programming mandates and execution with contractee organizations' strategic plan for moving services forward?
I've been reading that question for the last 2 minutes, and I'm not exactly sure how to answer it, other than it sounds kind of like a problem statement to an improvement, and an improvement project. So, if Don, you could clarify a little bit, that would be helpful for me. Megan, do you have a different perspective on it?
No, I agree. Some clarification would be great.
All right. While we're waiting for that, this next question includes some really nice reflections. This is from someone in a medium-sized health department looking for ideas that benefit the entire good of the department. And this person noted that they found breaking down the request into smaller bites and communicating often with the submitter have been helpful, as well as making sure to keep the focus very clear. However, finances tend to be very limited. Do either of you want to chime in with some ideas that would benefit the good of the department, or reflect on what this person said?
Good question. Yeah, Megan, do you care to jump in first? If not, I'd be happy to.
You go ahead, Ty. I'm just reading it again for myself here. Go ahead.
Yeah, so what it sounds like is there's a process in this department where they ask staff, what are things we can do that will benefit the entire good of the department? So change culture, create, positive things, in the agency. I think that's interesting. I think there's a lot of ways that, you can use aspects of your quality improvement plan or program to support that. Things like, assessing all processes. Are we operating at a high level with all of our processes? Are we engaging all staff from top to bottom of the org chart? A couple examples. Good comment. That's great.
Megan, would you like to add anything?
I don't think so. Thank you.
Okay. And with that, we're right at 3 o'clock. So I just really appreciate everybody's engagement in today's webinar. As a final reminder, we'll disseminate links to the archived recording and slides in the next week. I wanted to give a huge thank you to Meghan Johnson and Ty Kane for your excellent contributions today. I also wanted to thank Cindy Hutter with NICHQ for her support in making this webinar happen, the Robert Wood Johnson Foundation for making this webinar possible, and to everyone who attended today. At this time, I'd like to conclude the webinar.